When Gail first came in, I saw a lady that was terrified. I mean, I knew I couldn't really touch her the first visit. You know, I was just going to talk to her, find out what she needed, and take a look in her mouth, possibly, and that was about all I was going to get done. So we took a look, and we saw that she needed a lot of attention. I think she had a partial something that came out of the front, and she had some broken teeth on the side, and she was missing a lot of back teeth, and everything was in a state of deterioration. She had some gum problems going on. So we said, we can fix her. But she told me, not while I'm awake. And I said, that's no problem. I said, we can do that also. So we got her back, and we sedated her. And we put in some implants, took some teeth out, did some root canals, did some fixed bridges. We aligned her jaw. We found out where her bite should be. And we did some periosurgery. So she walked out of here with teeth all over her. She had implants, teeth put back in, and these were temporary teeth, but she had teeth again, once again.
Because I remember saying to you, I'm not leaving here with no teeth.
That's right. We told her she was not going to leave without teeth. Right. So she walked out of here, and she had teeth again, and everything was fixed, was not going to come out.
I don't know what set it off, because I was so young at that point. That's as far back as I remember, as being in the 4th grade, and when my mom would say, it's time to go to the dentist, I would be terrified. I don't know if it was needles, anything in my mouth. I don't know exactly what it was. But later on, I had an experience where I did have a Novocaine from a dentist, and I passed out. And I remember waking up, and the dentist was kind of freaked out, which didn't help. You know, he wasn't calm. And then from that point on, I was done. That did me in. I was like, I guess I ended up finding a dentist that I was comfortable with in New Hampshire. And he did, I went for x-rays, cleanings, and I tried to go every year, twice a year, and I was doing really good at it. But he didn't do anything beyond that. He did make me that bridge that I had on the top, which I had for a long time. And then that is when I had a problem. When I came out here, the bridge was not staying on because the tooth cracked, and it wouldn't hold it. So I had to find a dentist. Now I was in trouble. I knew I was in trouble, and I knew I had to go to the dentist, and I had to find someone that would take care of me, that knew I was a baby and scared to death. And I looked through the internet and through the yellow pages, and I found Dr. Gonzales, and I liked his face. He seemed like a nice, warm guy. And I called the office, and Dee was extremely warm to me and comforting to me, and so I said, that's the place to go. On my first visit, when I came here, I was terrified to come. It wouldn't have mattered where I was going for a dentist, I would have been terrified. And I was afraid of what they were going to tell me. I thought they were going to tell me that I had cancer in my mouth or who knows what. My mind was going. It was working overtime. So that got me in a state, and by the time I was here, I was a mess. He's lucky I didn't just cry the entire time. They did x-rays. I think it's the first thing they do. It's a lot of x-rays, lots and lots of x-rays. And then he looked in my mouth to see, but he didn't scare me by saying, you have this, 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 and this, and this, and just naming things one after another, because that would have terrified me too. He just said, you have some work that needs to be done, and we can take care of you. And that, and that's all I needed to hear. I was told I was going to be here almost the whole day, and they gave me a blue pill to take it home. I was like, good. I took the blue pill, came in, and they gave me another blue pill, and then I believe I had nitrous oxide. Did I?
Yes.
Yeah. And the IV. I had the full boat. I remember them putting in the IV, not feeling it, thinking, wow, that's nice, because normally that's kind of a scary time. And that's it. I woke up, and it was over. Don't remember leaving. Went home, slept. You called me.
Mm-hmm.
That's all I remember. That's it. I don't even think I was in pain.
No.
I wasn't. A couple of things. One, I am smiling more because I was uncomfortable with the way I thought my mouth, looked. My husband's always told me I had a nice smile, and now he says I'm smiling all the time, which you have told me also.
Right.
And I have a lot more confidence now. And I like coming here, which is pretty shocking. Well, I think he picked up right away how scared I was. So he knew how he was going to handle me from, I would guess, that point on. I think he knew that he's going to have to, handle me maybe differently than some of his other patients, because he never knew if I was probably going to, I don't know, cry, run, I don't know. But he was just, he's just great. He's always taken good care of me and reassured me, and nothing's ever hurt, so I have no reason to fear him. I'm healthier. I feel better about myself. I feel better that I don't have in the back of my mind all the time, you need to go to the dentist. You need to go, you better go. And then ignoring it and not going, because I was scared.
Fear's a huge, powerful.
Well, it kind of works in a circle too, because you know you have to go, but you're scared, and you're telling yourself, but if I don't go, it's getting worse. It's going in a vicious circle, and I knew that all the time, so it was probably always on my mind. At some fraction of my mind was always thinking, you better get to the dentist, girl. And then it happened, and now I like to come here.
Oh, definitely. Absolutely. When the bite's off, you're putting more pressure on teeth in directions you're not supposed to. And that'll cause a lot of teeth to chip or fracture. It also causes, you put undue forces on them, it can cause gum problems as well, too.
Which
when she first walked in, she was totally terrified. But then once she was sedated, it's just like the most perfect patient, because she's an easy sedate. So it's so easy to work on.
I'm great knocked out.
Yeah. If you tried to work on her otherwise, there's no way you could ever accomplish anything.
No.
No. You just could not.
No.
But under sedation, she's perfect.
I'd be constantly, I'm very curious and nervous, and so I would have been constantly bugging him, and he would have gotten no work done, and I probably would have ran out of here.
And then under sedation, we were able to do implants, extractions, root canals, periosurgery, and not to mention putting crowns on all the remaining teeth. We did all this in basically one appointment.
One appointment.
Yes.
Which probably would take 4 or more?
It took us, it was what, about a 7-hour day when we worked on you?
It was a 7-hour day that you worked on me.
Right, so if you were
My
to
first time, yeah.
If you were to do that non-sedation wise, you're talking maybe 10 to 15 appointments.
Can you imagine? In one day. It's one of those things too where when I came in, I knew I was going to have a lot of work, but I didn't know I was going to end up with this great amount. You know what I'm saying? I didn't know it was going to be this good. Yeah.
Good.
He's great. He's the best. Just highly recommend anybody, even if you're not scared, to come here, because this is a very warm, friendly dental office, and the dentist is awesome.